Hi, this is Dr. Kevin Smith. Thank you very much for checking out this video on the hidden secret number 8 of why you still have low thyroid symptoms even if you're on thyroid replacement hormone and even if your lab tests come back as normal. And the hidden secret number 8 is due to anti-TSH receptor antibodies. Now that's a mouthful. I'll say it again. It's due to anti-TSH receptor antibodies, also known as TSH immunoglobulins. So what's going on with this? As we talked about in the past, we talked a little bit about autoimmune disease and how it affects your thyroid gland. And with autoimmune disease, as it relates to the thyroid gland, there's a condition called Hashimoto's disease, where your immune system starts to attack the inside of the thyroid gland, destroying TPO, thyroid peroxidase enzyme, also thyroglobulin, which was the precursor to T4. And in this case, what's going on is that the immune system is either going to stimulate, bind, or block the production of TSH. Now, when this happens, typically, this is most commonly associated with hyperthyroidism or Graves' disease, where people will have racing of the heart, or they'll feel real fidgety, or they'll just be real wound up. But this can go both ways, and sometimes it can even cause people to oscillate between low thyroid symptoms and high thyroid symptoms. So what happens here is that when the immunoglobulins bind to, or they stimulate the TSH receptor sites, it can actually raise TSH levels, causing mimics TSH, mimicking excessive T4 production, and then you develop the high thyroid symptoms. If it blocks the TSH receptor sites, then you have the low thyroid symptoms, and if it binds to the TSH receptor sites, then you have subtle symptoms, and it can go either way. It can either go to low thyroid or high thyroid. And sometimes when people come into the office and I run a TPO or a thyroglobulin antibody test, which is this screening test to check for Hashimoto's, and they may come back negative, you can still have Hashimoto's, even if those are negative, because the autoimmune attack may not be on those, but it could be on actually the TSH receptor sites in your body. So you can still have autoimmune attack, and it can still cause problems. And the thing is, this condition, like the other ones that we talked about, they are called hidden because the doctors that you go to, the endocrinologists and the primary care doctors, they don't check for these things, and so they never get properly diagnosed, and you don't know who to go to for help. So even if you go to the endocrinologist or your primary care doctor and they put you on a thyroid replacement hormone, that doesn't necessarily affect the autoimmune component of what's going on here. And again, according to the research, 70 to 90% of all hypothyroid problems are due to Hashimoto's. It's a very, very common problem. It has to be checked properly. You have to go to a doctor that knows what to look for and which test to order to check for these things. I hope you enjoyed this video, and I hope you learned something. Please feel free to communicate with me through my website at integratedmetabolic.com. Please also subscribe to my YouTube channel, and please tell a friend. Thank you very much for checking out this video.